Good evening, everyone. My name is Anna, and today I will be sharing my philosophy of health education and promotion. My philosophy statement is that health education is collaborative, equity-driven practice that empowers individuals and communities by building health literacy, honoring cultural identity, and transforming systems shaped by the social determinant of health. I will also be providing you an overview of my beliefs, influences, and a future role. I will outline 3 main points. First, that health education should empower individuals and communities. Second, that it must address social and structural influences on health. And third, that it should respect and integrate cultural identity. I'll discuss the beliefs shaping this philosophy, the influences on my journey, and my vision as a health education specialist. Health education must address the social determinants of health, or SDOH. Social determinants of health shape where people live, work, learn, worship, etc. Inequities are driven by long-standing structural systems, and health education promotion must focus on equity and upstream change. So my first core belief is that health education must address the social determinants of health. Non-medical factors such as housing, income, education, environment, and social context influence health outcomes more than clinical care. The CDC's prioritization of social determinants of health literacy, and equity highlights the importance of addressing the root causes of inequity. Some supporting details for this slide is that CDC defines social determinants of health as a non-medical condition that shape health outcomes. Healthy People 2030 prioritizes social determinants of health alongside equity and health literacy. And the CDC notes centuries of racism as a root cause of inequities. Health education must build health literacy as a measurable skill. So health literacy equals measurable skills, not just information, functional, interactive, and critical levels. Skills are shaped by context, not only individual effort. So for my second belief is that health education must develop health literacy as a measurable skill, not simply just provide information. We must support individuals in developing functional, interactive, and critical health literacy while also improving environments that enable their use. Health literacy is both an individual skill and an organizational responsibility. Some supporting details for this slide. Don Nutbeam's model defines 3 progressive types of health literacy that were adopted by the World Health Organization, or WHO. Health literacy depends on policies, communication systems, and culture. And the WHO frames health literacy as a set of personal and organizational competencies. Culturally grounded, community-engaged practice is essential. Communities are experts in their own lives. Cultural identity is inseparable from public health. Community-engaged research increases effectiveness. So for my third belief is that health education must be culturally grounded and community engaged. This requires valuing community expertise alongside academic knowledge and designing programs in partnership with communities. As Ariyambua states, public health should promote cultural identity rather than a forced universal view. It is worth mentioning that Ariyambua's work shows that ignoring cultural identity produces inequitable outcomes. Here are some influences on my beliefs. Don Nutbeam, Keith Tones, Collins Ariyambua, and national academies. Scholars have shaped my philosophy and broadened my perspective on health education and promotion. Nutbeam emphasized the importance of measurable skills, while Tones demonstrated the need for ideas to withstand critical evaluation. Ariane Bua highlighted the necessity of honoring cultural identity in public health. And the National Academy's framework emphasizes lifelong learning and collaboration as essential skills for future of our field. Influences on my beliefs, my personal experiences. So, growing up, observing inequities in my community, mentors that encourage equity driven thinking, experiences with diverse populations, and exposure to structural barriers in the real world setting. My career has been shaped by both personal and professional experiences that have deepened my understanding of health disparities, directly informing my philosophy of health education as an equity driven practice. For example, coming from a multicultural background, I have witnessed how uneven access to resources led to significant differences in health outcomes among people in my community, and it made the consequences of inequity clear to me, underscoring the importance of addressing the social determinants of health educational approaches. With the guidance of mentors, I've discovered that health education offers tangible strategies to confront systematic injustices, reinforcing my belief in empowering individuals and communities as central to my philosophy and motivating my commitment to pursuing equity-focused work. Working with diverse communities that showed these structural barriers have strengthened my commitment to equity and community-focused practice. My future role as a health education specialist: to act as a convener, integrator, and influencer, promote equity through social determinants of health focused strategies, strengthen organizational health literacy, and use community engaged, culturally responsive approaches. As a future health education specialist, I will bring stakeholders together, integrate data, and influence policy change. Grounded in my belief that health education must address social determinants of health, I aim to improve organizational health literacy to promote equity. In pursuing these objectives, I recognize that several challenges may arise in practice, including institutional resistance to systematic change, resource limitations, and navigating cultural differences within diverse communities. Therefore, as I foster supportive program environments and design interventions that genuinely reflect community voices and cultures, I must remain critically reflective and adaptive. I believe that by anticipating these barriers, I can develop more responsive solutions and strengthen my commitment to culturally grounded, community-engaged approaches. In closing, health is shaped by SDOH culture and systems. Health literacy empowers individuals and organizations. Community engagement ensures sustainable equity. My philosophy guides my practice and career. So as health education centers on equity, empowerment, and partnership, health educators must address the social conditions influencing health, promote measurable health literacy, and ensure community-driven, culturally grounded practice. These beliefs guide my work to build healthier, more just communities. Thank you for listening to today's presentation, and the next slides that follow will be the references used for this PowerPoint. Thank you. References used for today's presentation: